states are reeling from the twin health and economic impacts of the Delta strain. Have a look at this. In Europe, cases have increased quickly. Look at that, since the beginning of June. And in countries like the Netherlands, there's been an almost vertical rise in new infections. Well, yesterday the Dutch Prime Minister apologised to the country for easing restrictions too soon in late June, reintroducing a range of measures.
Wat wij dachten dat kon, dat bleek in praktijk toch niet te kunnen.
What we thought was possible turned out to be wrong in practice. We made a miscalculation. We're disappointed about it and we apologise.
Make no mistake, this is COVID's dramatic second act, and very few nations are walking away unscathed.
We need to be blunt when we need to be blunt. The global situation is we're not in a good place. In Africa, there was a 16.7% increase in cases in the last 7 days. There was an 16.4% increase in the Eastern Mediterranean region, a 33% increase in cases across Europe, an 8.6% increase in Southeast Asia, a 10% increase in the Western Pacific. There are more than 24 countries that have epidemic curves that are almost vertical right now, almost vertical.
Stephen Duckett, what we're seeing, and it's just actually, we're just beginning to understand it this week and last week, is that even those countries with 50 and 60% immunisation rates are in strife with this. They thought that if they got to those numbers, they vaccinated the elderly and the vulnerable, they'd be right. What's changed?
So there are two things that have changed. So back in March, we had the results of the vaccines for both AstraZeneca and Pfizer, very high protection levels, efficacy against the virus. What we now know is the Delta virus is more easily transmittable, so it spreads more easily. That's one change. And secondly, the vaccine, AstraZeneca, for example, is not as effective against protecting you against the Delta virus as it was against the previous variants. So more transmissible and also not as much protection is not good.
Mm. And so is this the kind of estimation that they're looking at? Like UK, if they open up on Independence Day or Freedom Day, whatever they are calling it, which is coming up this month, they're facing 100,000 cases a day by August, and they'll expect 100 deaths a day. So is it just a matter of when you say it's more transmittable, that just means, yeah, you might have got the death rate right down because of your immunisation rates, even with AstraZeneca, you know, it's quite good. But if you've got 100,000 cases, 1% of that, or whatever the number is going to be a lot more people dead.
Yeah. So all of these projections so back in March, people were saying, oh, look, maybe if we get 60 or 70% vaccinated, that's going to be great. That's when we can open up. No one is talking about those numbers now. They're talking about 80% rather than 60 or 70. So we're looking, and the UK, for example, is still below that 80% threshold. So we're looking at quite a different situation now from what it was back in March. And don't forget, Delta is only the fourth letter of the Greek alphabet. I think we're up to Lambda in terms of the variants that are floating around. So, we've got a lot more experience of this virus yet to come. And
just for clarity, when you say 80% now, is that 80% of adults as we think of it here in Australia, or is that 80% of...
No. Kids are people too, So 80% of the whole population sort of is the number we need to be talking about. The modelling has to be actually done, but it's way up there, which means 95% of the vulnerable population needs to be vaccinated. So it's a big task. It's not an impossible task. A big task that is in front of us, and the Delta variant means we have to be moving on this as rapidly as we can.
And again, I don't need an answer, just a yes or no. This is because the death rates are down, the hospitalisation rates are down due to the work they've done in vaccination. But if you just have this Delta thing going hell for leather and you have that many cases because it's more transmissible, even with a small percentage of people hospitalised and dead, that's still too many people.
Yeah, so you've got to actually make sure your numbers are all right because the vaccines work.
Yeah.
You know, Pfizer works against Delta. Pfizer has worked against the others. High levels of protection, but it's not perfect. And so you've got this small chance, and AstraZeneca is even less perfect. So, you know, it's something we still have to worry about the virus. We still have to get the vaccination rates right up there.
And the other thing that's coming through, Christine, is this is a pandemic of the unvaccinated now. This is what the Europeans are experiencing. It's a pandemic of the unvaccinated. And who are the unvaccinated in Israel, in the UK? And they're young people. They're young people.
It's not just young people. 60% of the people who died in the UK were disabled people. And, you know, this is going to happen again. What is not happening right now? You know, everyone's clambering to get vaccinated. They're all climbing over the top of each other to do it. Great. You know, that's excellent. It's good to get vaccinated, except what isn't happening is we're not collecting the data on who the people are who are being vaccinated and who are unvaccinated. So the government, you know, has been planning this.
You're talking about in Australia now?
Absolutely. The government's been planning this since December, January, except what they came up with these phases, these categories. They're unable to tell us how many people in 1A have been vaccinated. We discovered that with aged and disability care workers. They couldn't tell us how many had been vaccinated. They're all in 1A.
So we don't know who the unvaccinated... If this is a pandemic of the unvaccinated, that's what Delta is.
We have no idea.
Yeah.
The 1B people, and there's a hell of a lot of them out in the community, you know, we don't know how many of them have been vaccinated, and they're having an enormous problem. They can't just turn up. They're not able to get appointments. They can't jump queues and say, I'm 1B, I should be ahead of you. That's not a system in place. So we're not collecting the data. We don't have systems in place. And so we're going to end up with the Delta variant come through, and suddenly everybody thinks they're an essential worker. We've got a problem.
But no, I guess the point out of all this is, you know, we all watched Wimbledon and we all watched the soccer the other night, and it appeared that they were ready to come out of this now in the UK. And then you look at the rates of cases in Spain, across Europe. We saw the Dutch Prime Minister. And you think about where they are and where he are. This is a much longer road now.
It's a really long road, and I don't want to be the UK. I don't want to be talking about cases in the hundreds of thousands. I think we need to acknowledge that we did well in the public health context in the first rollout, I suppose, in the first stage of last year. And we accepted as a nation that we didn't want people to die. We did the best we could. We worked together. We accepted that was the way that we should move forward. I think it's the way we still should move forward. I think that the federal government in particular keeps planting seeds about having to live with the virus to the Australian public to try and get us used to a position that says that we'll accept that people die. I don't accept that people should die from this virus. I think that if we can avoid it, we should. And as Christina rightly points out, there's a whole lot of people with disability, for example, who are vulnerable. There are a whole lot of people with chronic illness who are vulnerable. Aboriginal and Torres Strait Islander communities have done an extraordinary job of keeping it out of remote communities. And by that I mean communities, for example, in New South Wales as well. No one ever thinks of the other states when it comes to rural communities, but that's been done. So I think that the road that the UK is taking is dangerous. It's not one we want to take.
Well, as we've seen, have a look at this, Luke. Next Monday, the UK is set to lift all of its COVID restrictions, including the wearing of mandatory masks and social distancing rules, all of it. Now, this despite, as we say, that Delta variant running wild and the country currently recording more than 30,000 cases a day. Freedom Day, as it's known, is being described as an experiment in what living with COVID might look like. It's a description that Richard Horton, editor of the medical journal The Lancet, has taken umbrage with.
We know that there will be an increase in infections. That's not an experimental hypothesis to test. We know that hospitalizations are going up. We know that there will be an epidemic of long COVID, and we know that we're creating the risks for new variants. That is not in doubt. So what we have is a government that is pursuing an ideologically driven commitment to force the population to accept a level of mortality and disability.
See, look, there are those in the Liberal Party in New South Wales who want to conduct a similar experiment. There was a breakout in Cabinet. We read about it in the newspapers. 3 Cabinet ministers said, let her rip. I mean, is the bottom line here that if you're the sort of Liberal who says, I believe in small government, you believe in a big pandemic?
I wouldn't say that. I think there's probably more frustration that the end is not in sight yet, and it comes down to where do we want to be as a nation and what is that level of risk we're willing to take now. Following the health advice, Australia's taken a very high threshold in terms of public health and safety, which I think is the right decision to take.
But only because the Premier of New South Wales seemed to wrestle 3 Cabinet ministers to the ground and say, we are not doing it. I mean, there's a front page report in this city last week that said, we want to lift this lockdown for economic reasons in New South Wales. And there was a strong push apparently by the Treasurer of New South Wales to let her rip. Small government, big pandemic.
Look, there are those reports, but you need to take everything on the whole, which is most state premiers are adopting a very similar
But I'm talking
approach.
about the Liberal Party here.
Yeah, but look at South Australia with Stephen Marshall or Peter Gutwein and Tasmania, or the Prime Minister through National Cabinet, and Gladys Berejiklian. You can say, look at the Liberal Party and then say, well, Gladys Berejiklian isn't part of the Liberal Party. She's the Premier of New South Wales and the Parliamentary Leader of the Liberal Party.
Well, is this the death knell for the let her rip, small government, big pandemic in the Liberal Party?
I don't think that's even a proposition within the Liberal Party more broadly.
Certainly it's a proposition within the Liberal Party.
It may be the view of a couple of cabinet ministers around the table, but let's look at what is actually happening, which is not the Liberal Party governing here. It's the democratically elected government of New South Wales under Gladys Berejiklian's leadership, and John Barilaro as a National Party Member of Parliament as well. And what we need to remember is that under all the projections, Australia was never going to be here in July 2021, being in the position where we could open up the economy through vaccination rates. And we're seeing that play out overseas. Here we're talking 80%. In the United Kingdom, as we've just been discussing, those vaccination rates are somewhere between 50 and 60%.
But I am just interested in your political brain just finally. I mean, Queenslanders are going to be asked to vote next year in a Senate election, same as everybody else is. And number 2 on the LNP ticket is Matt Canavan. And he said to Patricia Karvelis, my colleague, the New South Wales lockdown doesn't justify the costs, and Australians need to learn to live with COVID-19 despite low vaccination rates. So a vote for him in the Senate is a vote for a big pandemic. That's the bottom line, isn't it?
No, a vote for the Liberal National Party in the Senate's a vote for Scott Morrison as Prime Minister.
You will elect, the people of Queensland will elect Matt Canavan, who is a very powerful senator from Queensland, who influences energy policy, climate policy in this country, and said, let it rip.
Well, I disagree that Matt Canavan is dictating government policy at a federal level. At the end of the day, these decisions have been taken on a whole. It's why National Cabinet was established. And I think there is still a little bit too much politicking around the red shirts and the blue shirts and their views and opinions. Now, the Liberal Party has always been a broad church, and we've always entertained a range of views on various matters, but at the end of the day, consensus is reached, and that's how cabinet processes should work. And, as the famous saying goes, I don't care what we say as long as we're all saying the same thing when we walk out of the cabinet room. So,
spoken like a true advisor.
Well,
have your fights inside.
Well, that's the beauty of cabinet government. And again, Gladys Berejiklian has made very clear that the preeminent decision driving the government's decision-making here is the health advice, and Dr Kerry Chant's been absolutely stellar. I think she's someone that all of New South Wales can be very proud of. We've
got to get to this story, Luke. You love this story as much as I do. Former rugby league star Paul Gallen has expressed his concern for the welfare of NRL players who are being forced into a COVID bubble in order to see out the league season. On Wednesday, 12 NRL teams and their support